Welcome to the ANEW Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us.
Welcome back to the ANEW Insight podcast. We are back for the second half of our interview with award-winning dietitian and chef Sherene Chou. She gave us some really amazing insight into her history and background with vegetarianism and how she transitioned to a vegan diet and how that diet for her benefits the body and the planet and how she promotes sustainable and equitable access to food. I'm so excited to pick her brain some more. So, how do you think the field of nutrition is evolving to incorporate sustainability, and what does the future hold for nutrition education?
I think there had been a lot of changes, but not enough changes. And so I think sustainability is slowly being incorporated into some nutrition programs. And there are even programs that are solely focused on sustainability. But overall, I think as for practitioners, it's not a requirement. And I think that's something that we're working to change. So right now, we're actively working on creating programs with, so Meatless Monday was co-founded with Johns Hopkins Center for a Livable Future. So we're actually working with them to build out nutrition curriculum for all nutrition programs across the country. So this is just an introduction program for dietitian, dietetic student, internship directors, and everything that we do with Food and Planet, everything we create is free and open access. And we really wanted to separate ourselves from the academy as well as other organizations where we don't take any industry funding whatsoever, because there's just so much that can be, I guess, challenged in terms of building out education or building out information. And so that's something that we took a really hard stance on as an organization. And we started our organization in 2020. Our first year, we did take some funding just to show our concept. But after the first year, we took some funding from Barilla, Cliff, as well as Danone. And that helped shape. They had no influence on our education, but it did help shape and get our organization started. But after our first initial year, we made it a point and kind of a policy not to take any industry funding. And we're really proud to continue to create education for health professionals and make everything free and open access.
Wow, that's amazing. What do you hope to accomplish with this organization?
Well, we really do want dietitians and health professionals to feel like they do have the power to help people shift towards more sustainable diet and be engaged in the sustainable food systems conversation. Even though it isn't part of our education, so many people are interested in this topic. Dietitians, newer students are interested, but they really don't know where to go to for information. And I think in these larger conversations in terms of policy and even convenings, dietitians are left out of those conversations where we really should be right there with everyone else having these conversations and making these changes. We have so much information, so much knowledge, and most of us are seeing patients and clients one-on-one. 3 years ago, we launched the first ever survey assessing dietitians' attitudes towards sustainability. This was co-launched with Today's Dietitian, which is our industry magazine. And year after year, we've just been seeing dietitians, their hunger for this information and also their need to be educated on this piece. And so this was something that was really missing. And we are launching our next annual survey on Earth Day. So be on the lookout for that one.
And what's the
The
content of the
survey,
survey?
the content of the survey is directed towards dietitians, and it's really assessing their attitudes towards sustainability. So
Mm.
it's not really assessed. Yeah, their attitudes towards sustainability and how that might change over time. So this will be our third year launching, third year, third or
Oh,
fourth
that would
year,
be
third
so
or fourth
wonderful,
year
and
launching.
it's so necessary, not just for sustainability, just but for also information and education that is
Hmm.
not funded by
Yeah.
industry. I think that that's really important is that we really focus on trying to get pure science out there and really to understand the impact of these food systems on the planet and, how that affects
Hmm.
sustainability. So now I want to pivot a little and I want to talk about something very important to
Hmm.
you, which is cultural inclusivity. So
Yeah.
tell me about the role of cultural inclusivity in promoting plant-based nutrition across diverse communities.
I mean, thanks so much for asking that. Just, I think you know this too, that, in our curriculum, in our education, we had one world or cultural foods class. I mean, and I always joke about that when I'm giving presentations because how can one class cover the whole world? And of course, we didn't. And that's also ridiculous because there are so many different people, especially, living in Los Angeles, we serve so many different people, talk to so many different people, and food impacts everyone. And so not to be seen in, the things that we're learning, it feels like you're overlooking so many populations and communities and essentially telling them that maybe they don't really matter or that the foods that they're eating are just not appropriate, which is not the case at all. And
Oh,
so
absolutely.
being able to, I think, help people see that what they're eating is healthy. It can be a part of a healthy diet, that their traditional foods are welcome. I think a lot of those concepts are not, I wouldn't say newer concepts, but these types of conversations have evolved since our education. And so I think initially, just during our education, I don't feel like it was talked about really at all to celebrate people's cultural food. And I think over the years, more and more conversations around that have happened and even like in popular media. And that's something that I continue to advocate for in everything we do, including Food and Planet. One of those pieces is sociocultural and making sure that we are creating a supportive environment, welcoming all cultures, welcoming all people, welcoming all types of food. There is a place for all of that. Recently, I spoke at a conference called Healthy Kitchen, Healthy Lives. And this was my third year speaking at that conference. This is a conference directed towards health professionals, put on by Harvard as well as the Culinary Institute of America in Napa every year. And I joke that in my session, I'm covering Asia, like quote unquote Asia, which is that's just impossible. How could I possibly cover all of Asia in 20 minutes, basically, including a cooking demo? And so, I try my best. One of my first few talking points is, I'm not going to cover all of Asia. Like, that's just not possible for me. But I do think that, there's a really helpful map that I share, which is that, in every different state, there's, whatever the large majority population is, I think that's helpful to know. But even, knowing that, Chinese population is a big majority in California, we don't really have resources that are directed towards this community or even any community that's, non-white. One of the resources that I found on our academy's website, was something where it was translated into Chinese, but everything on there was not appropriate for someone who is Chinese. Like my parents would not follow that advice on that piece of paper. So what they essentially did was just kind of the typical American diet, but translated it to Chinese. So you're recommending people eating tortilla or pita, which is not something that my parents typically eat. So just really basic things like that, where it's still missing in our education and our resources, is why I continue to advocate, why this continues to be a big part of what I do in all the education that I create.
So important. And I think historically, especially at the time when we were in school, there was a push to healthify a
Mhm.
lot of cultural food, which I think a lot of people found really offensive, substituting the brown rice, take out the white flour tortilla, things that were like really, fundamental to certain cultural cuisines. And there certainly has been a backlash against that. There's a lot of people out there on social media that, you know, kind of want to decolonize
Mhm.
essentially dietetics and nutrition. I think that that is so valuable and so important. And when you really look at cultural foods historically, when you really get into the rural cultural foods, so many places, you can just look at the blue zones for an example. The Koya Peninsula, Sardinia, in Italy, Greece, and Okinawa in particular, those rural foods have shown to be some of the most health protective foods
Mhm.
and that really do promote longevity and prevent against disease. So I think we have so much to learn rather than impart upon these
Mhm.
cultures. And so it's really wonderful that you are such a strong advocate for that. And I think we need a lot more voices out there really to promote and investigate these foods as medicines. So to transition to that, you talk about culinary medicine a
Mhm.
lot. And I really
Mhm.
want you to expand upon that because I don't, people throw around, food is medicine all the time, but they really
Mhm.
don't necessarily believe that. They don't
Mhm.
necessarily believe you are what you eat or that, the people can still say a calorie is a calorie, which is totally not true. So, how can culinary medicine be integrated into medical education to improve patient outcomes? Because right now, I think we're looking at a sick care system as opposed to a healthcare system.
Mhm. I mean, that's also so in January, I was invited to be a part of this group to define culinary medicine. And no definition yet because that was just a 2-day event. There were 15 of us, doctors, dietitians, chefs came together to talk about how do we really define culinary medicine because this term, like you said, is used all the time. It is used all the time in so many different ways. Um, yeah, just it used in so many different ways that it can get very confusing. There has been a shift to build in nutrition education into medical school the last 10 years. There's an organization called the Teaching Kitchen Collaborative, which I'm an advisor on as well. And that's something that started about 10 years ago. And it's really looking at all the different spaces that have teaching kitchens. So whether you're in a hospital, a university, community, a school, these all different places have teaching kitchens. And people are these to build out classes that are educational classes. Maybe they recently got a diagnosis or got something from their doctor or dietitian that said, hey, you need to be on a low sodium diet or any something specific like that. And people are generally confused as to what to do. And it's amazing to have these spaces where there are built-in education programs that are maybe 5 week, 10 week long
Mm.
that people can attend to really learn how to cook cook that way or eat that way or just be exposed to different ways to really not feel kind of burdened by their diagnosis, but rather to still continue to enjoy and celebrate food in a fun way.
I love that. I think that's wonderful for the public. And I'm wondering too, and I think there's many doctors that will admit they only get maybe 25 hours at most
Mhm, mhm,
nutrition education. Yet a lot of people really go to doctors for dietary advice and they are kind of woefully less educated. How can we help doctors? Do we work with the schools? What do you have as suggestions to help doctors just be more on board with nutrition as a part of their interventions?
I think doctors are very interested. Not, I wouldn't say all doctors, of course, not everyone is interested, but a lot of people because we all eat. And so doctors really they are really, hungry for this type of education. I helped USC School of Medicine build out their first culinary medicine course. And it's like, because it's not a requirement, I think that's where the things need to change is that it needs to be a requirement within these medical schools to make this program consistent or to have ongoing curriculum for doctors because med students want to learn, doctors want to learn, want to be educated. I think a lot of people are finding different ways to be educated. There's a whole organization called the American College of Lifestyle Medicine, ACLM, where they are focused on just food and overall lifestyle medicine, including stress management, all of these different things. So doctors are going there to get certified in lifestyle medicine to learn more about this whole body and whole person approach. And so I think if we're able to change medical curriculum, medical education, kind of starting from there, advocating for that, people want to learn, doctors want to learn, med students want to learn. It's just a matter of building it into that piece. And I would say that with the Teaching Kitchen Collaborative, there's so many different organizations that are there's medical institutions, universities, hospitals that have teaching kitchens that are dietitian led. Doctors advocate for it, and dietitians are able to lead those classes and share out those classes because that's our expertise.
So important. And this podcast will probably air after this happens, but the American Psychiatric Association is having their conference here in Los Angeles in May.
Oh, wow.
And their focus is lifestyle medicine. I was
That's
like,
amazing.
what? This is amazing.
Yeah.
Dr. Dean Ornish come and
Mhm.
speak, who, if you don't know who he is a big plant-based medicine proponent. He was the one who treated President Clinton when he had major heart problems, put him on his program and reversed President Clinton's health to where he's now just, really thriving and free from cardiac disease. So I was so excited to hear about that, and I got
Yeah.
invited to go with a psychiatrist associated with my psychological association. So I'm hoping after this conference, I'll be able to find more guests there that can really help to promote the message, that we really do need to incorporate nutrition as a lifestyle intervention first.
Yeah.
If we were to do that, there would be so many benefits, including healthcare cost savings, if you were to approach medicine from more of a preventative rather than reactive stance, as we're seeing today. So, fingers crossed. I'll report back to you, Sherene.
Yeah, that'll be great. I'm excited to hear about that.
Absolutely, definitely. So, what advice do you have for dietitians and nutritionists out there in terms of the people that are really aiming to promote plant-based diets within their practice? What are some helpful tips that you have for them to be able to incorporate this kind of education?
I would say, well, just being the past chair of the vegetarian nutrition practice group, there's a lot of amazing resources there. If you haven't heard of it, but I mean, joining that there are so many benefits. There's a whole library where there are one pagers that are focused for, dietitians. So there's a one pager on almost any type of condition or specific nutrient that you can educate yourself on, and then also a consumer or patient focused one. So there's already resources there so to help you educate yourself and easily download and share it with your patients. I mean, that's one piece. A second piece is just, I think, engaging more. I mean, we all get the same education, and I think that the dietary guidelines and my weight inherently is a plant forward model, right? Half your plate, fruits, veggies, whole grains, quarter of your plate is protein or whatnot. And not everyone eats obviously off of a plate, which is another topic, but being able to encourage just more fruits and vegetables and, celebrating what people are already eating and finding things that people really enjoy. Just shifting away from being too prescriptive and talk more about enjoyment.
Mm, I love that. And I think probably what is the number one most common question that they might get from the public is how do I get my protein? I won't get enough protein. This pivots back a little bit to what we were talking about in the first half, but a lot of people have misconceptions about plant
Mhm.
protein. What do you have to say to not just dietitians, but people out there as far as their, you know, where do I get my protein? I hear it's not complete. What do I do about that?
I wish I had that paper readily available, but there was a paper published. It's the protein index paper. I don't know if you've seen it. For one of my co-founders, she was one of the authors on there, this protein index paper. And just talking about viewing protein in different lens. And also there's been also a lot of papers published talking about all foods have all the amino acids. It's just varying levels. And so I think that is just something that is missing in our education, or the misconception is out there. But, you do, I think, I wouldn't say if you're switching to a 100% plant-based diet, I mean, definitely work with a dietitian to plan out, what your needs are. And don't make it too complicated. Most plant foods have protein, just varying amounts, and being able to plan out and figure out what those foods are and choosing from those buckets just like you would with fruits and vegetables. Don't overcomplicate things and just be open to trying different things.
Yes, I agree. And I think a lot of people think you have to, meticulously combine foods.
Yeah,
That certainly
absolutely not.
was Yeah, that was the messaging from before. We
Hmm.
certainly got that in our
Hmm.
education and have subsequently learned, well, that's not really quite true. You do have different amino acid combinations within different foods, but if you're eating a variety of foods and
Hmm.
concentrating on those plant foods that do contain more protein, then just the
Hmm.
combination itself gives you all that you need in a day. And it doesn't have to be something that you weigh or you measure or you really,
Exactly.
stress about. As long as you are really incorporating beans, legumes, whole grains, all
Hmm.
sorts of plant foods and fruits, you're going to get plenty more than you need. And I think that that will help dispel this, protein centric, sexy media topic on protein. I think if we can incorporate plant protein in there and make that sexy, certainly that will be more helpful for our health because we're getting all of the benefits of
Hmm.
plant protein, which people are seeing are, you know, vitamins and minerals, the
Right.
fiber that you get. You don't get any fiber from animal based protein.
Hmm.
You do get a lot of benefits from plant-based protein, and when you talk about sustainability and affordability, it's much less expensive to eat in that way. If it's not all the time, some of the time, or even just a little bit of the time. You don't
Hmm.
have to worry so much about protein, you guys. You don't have to worry so much. We're doing fine. We are doing fine. So, Shereen, we're running out of time, but I want you to kind of let us know what's kind of coming down the pike for you
Okay.
and how people can get in contact with you if they want to work with you.
Yeah. So we're working on, this is to all the health professionals out there. We're working on, this Johns Hopkins curriculum for nutrition programs. We're also working with Food EDU, which is a part of American Heart Association, to build out a global nutrition curriculum that's also open access on sustainable food systems. And that should be launching in the next year and a half on the American Heart Association's website, open access as well. So we're currently in the process of building that out. It's really exciting. And then very immediately in the future, we're doing a promotion at a supermarket chain in the East Coast focused on showcasing all different types of aquatic food, which are blue food, ocean food. So talking more about ocean sustainability, which we didn't get into today. But we have a whole cookbook called Blue Food is Medicine that's open access, free, and downloadable for everyone to utilize. There's a whole website called eataquaticfood.org, and you can go to the cookbook page and see recipes focused on different scallops, mussels, and clam. Those are sustainable ocean foods, as well as seaweed, all different types of seaweed, which are plant-based ocean foods.
Yay. Oh my goodness. You have so much going on. And, we are 10 years out of our program and out of our internship. And look at
Yes.
all of the amazing things that you have done. I'm really proud of you, Sherene. You're doing
Thank
amazing
you.
work out
Me
there.
too.
I love it.
Thank you.
And tell people your website so they can go to you.
Yeah, and you can go to foodandplanet.org or find us on social media, foodplanet.org.
I love it.
Or my personal one, Eat Sustainable Foods.
I love it. And those will be in the show notes, everybody, so you can go and check out Sherene's amazing work. Sherene, thank you so much for coming on the podcast. We definitely have to do a dietitian reunion very soon. And
Yeah,
I'm going
that'd
to
be
plan that
amazing.
because I keep talking about it. It needs to happen. But thank you so much for all the work that you're doing out there. And it's so great to reconnect with you again.
Yeah, same here. Thank you.
Yes, and thank you all for tuning into the ANEW Insight podcast. We're looking forward to our next interview and really hope you join us next time.
Thanks for tuning into the ANEW Insight podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.